From the Faculty of Science and the School of Computer Science at the University of Auckland, it's Dr. David Welch. David, good evening to you.
Hello, Pat.
Now, let's do this. We have you for a short amount of time, so let's rip into this. Watching you on, I think it was One News last night. Maybe you're on all the news channels.
Three News, I think. Yeah.
3 News, okay. There was official numbers come out this week of 20,000. You say it's probably double that. It could be in the 40,000 new cases per week. Yesterday, to just truncate this conversation, we had a look at the last time New Zealand had 330-ish hospitalizations, which was the middle of May, and at that time there was 7,500 daily cases. So it feels like, using that data, you're probably spot on. What does that mean for where we're at the moment in the country, especially when it comes to the government seeming to want to be hands off?
Yeah, I mean, we've been seeing cases going up for a while, and I think it's a little bit tricky exactly what's going on. I think the reason is that we dropped those health protections, restrictions, whatever you want to call them, mid-September, and cases have been creeping up since then. The rate of increase has taken me by surprise over the last week. Cases really seem to be jumping up at the moment, and we have got our eye on various variants out there, but none of them are at a particularly high level at the moment. So so I guess where I'm leading with this is, it seems to be driven by this this relaxation of restrictions. You expect a bit of a bump after that sort of relaxation, just because there's a little bit more transmission out there. People are getting a bit looser, maybe. But then you expect that to come back down again once a fair number of people have been infected. So
will that mean that we're on the way up right now and you expect it to plateau, or is this we're on the way up and who the heck knows what's going to happen next?
So I think we're on the way up. We expect it to hit a peak at some point and then come back down. The question is, where is that peak? And
look, what we're wanting to talk about as well, and this is the questions we were asking last night, is of course BQ1 and BQ1.1. What we know about it, and this is a story from over a week ago. It said U.S. health regulators on Friday estimated that BQ1 and closely related BQ1.1 accounted for 16.6% of the coronavirus variants in the country, nearly doubling from last week, while Europe expects them to become the dominant variants within a month. So let's say by the end of November, Europe is expecting BQ1 and BQ1.1 to be the dominant variant. What I hear you saying is that at the moment, BA5 is probably still our dominant in New Zealand.
Yep, very much.
But I guess what we're all trying to do is, what do we know about BQ1.1? A couple of the biggest questions are, it seems that if you've had an Omicron, whichever version of it, that you have been quite well protected from BA5 if you've had a previous Omicron. Do we know anything about previous infections, and I'm putting air quotes around the word immunity, but immunity from BQ1.1, or is it too soon to know the correlation between those different variants?
Yeah, BQ1.1 is descended from BA5, and it got a whole series of mutations that are picked up, and there's basically this cluster of mutations out there that each one of them seems to give a little bit of immune evasion to the virus. And BQ1.1 is noted as basically having the whole constellation of mutations with it. So suggesting that it has the highest immune evasion of any of the current variants out there.
So just for clarity, David, when you say the highest evasion of other variants, does that mean it's most likely to get past previous infections and the vaccine?
That's right. Yes. Although still the majority of cases, even with BQ1.1, I believe, are from people who haven't had a previous Omicron infection. right?
And the
So
numbers
any
listed on the news, the item
yeah,
you were in on the news last night, and the numbers listed, and I'm sorry to talk over you a little bit there, but as you know, we've got a short time. So, and the numbers listed on the news, they said only 10% of those numbers were reinfections. However, they're the official numbers. That doesn't account for potentially the other 20 to 30,000 people. And it seems, I've read research that says if you've got COVID for a second time or third time, you're even less likely to phone through your results. So of that 20 to 30,000, it doesn't mean it's necessarily 10% of the officials mean 10% of the unofficials, but they're the numbers that we're working from at the moment.
That's right. And, people have, analyses I've seen of this have suggested that, the actual number of reinfections out there might be something like 20% of total
Right.
infections. But, that still means that 80% are people who haven't been infected before. And so, this wave is still being driven by first time infections in New Zealand or, Delta or older infections overseas. So, yeah, so and given that, that tells me that um, we still, a previous Omicron infection does give protection even against these new variants. And so we wouldn't expect to see, the sort of peaks of cases that we've seen before. We wouldn't expect to be up above, 15,000 or 20,000, whatever it was we got to, 6 months ago. Um, but like I said earlier, it's not exactly clear when we are going to hit the current peak.
So I always want to know as much as I can for myself and be as clear for myself, but also for the audience.
Mm-hmm.
Because I think it can be said within the research that, other Omicrons were quite a good protectant against BA5. Is what we're saying now is that is the research, what you're saying is we are modeling for if you've had it before, you're a little bit more protected against BQ1 and 1.1. Like, do we have the hard data yet, or are these projections we're talking?
No, we do have the hard data, right? Because as you said, there's a lot of those variants overseas,
Gotcha.
and it would be clear if they had, basically those variants would really be taking off if they could escape sort of all immunity from previous infection.
So
And
we could
so,
look to America and Europe and see what's happening with their BQ1.1, take that
yeah,
data, which I guess is what you're saying is it's showing that it's more likely to be a COVID of new infections rather than reinfections, and be secure in that data that's what we're going to see here in the
that's
most.
right. That's right. And we've got a slightly different, we've had a slightly different mix of variants and timing of waves and stuff here. So, it's getting harder and harder to extrapolate from what happens overseas
Yeah.
to say, there's a variant popping up over there. It's definitely going to come here. So we've got to be a little bit careful about that, and that's why I'm not saying BQ1.1 is certainly going to cause a wave here. At the
Um,
moment, I think the latest stats show that it's still under 10% of cases here. So yeah, it's not driving anything right now.
is there any information? I noticed maybe a week, 10 days ago, there was a news story about Pfizer making an approach to New Zealand for the new booster that's Omicron specific as well.
Hmm.
Does that therefore mean the new booster is
Hmm.
likely to also give you the same sort of better protection, without saying it's guaranteed, as a previous infection would, because it's designed for Omicrons?
That's right. So we've seen that all of the vaccines can prevent some infection and onward transmission, not all of it. And the closer the booster or the vaccine is matched to the current variant, the
Yeah.
more protection it will give you against infection. I guess the other thing to note is that even the boosters that are on offer now, they don't provide great protection against getting infected, but they still offer great protection against getting sick. Yeah, so
Yeah.
I was happy actually yesterday. I went and got my fourth shot. So
Oh, nice. Oh,
yeah.
look, actually, there's a question for you as well. I know you're not a legislation guy or a
Mm.
policy guy, you're a science guy, but have you heard amongst your peers or anything about when this new booster will be available? Is there any word going around?
No, I mean, I'm not completely up to speed with how that actually works, but I know it's a lot slower here than overseas. Other jurisdictions have it out way quicker. What I've read in the press is that we can't expect anything before the end of the year.
Right. Wow. So, okay. Because I'm in that moment where I had my last shot kind of Christmas of last year, and so I'm due a booster, and I'm kind of going, shall I wait for a month or so to get the new one, or shall I just
I would strongly recommend that you get that as soon as possible.
Right. You've sold me. Sold, David. Sold. Hey, we've got 60 seconds.
I think it's really important. I was looking up the numbers the other day. There's over 1.5 million people who are in New Zealand who are due for a shot at the moment. Essentially, it's the main protection we've currently got. Right. Yep. There's no mask wearing in public transport or anything like that. People should go and get their boosters. It's easy. They're available at the pharmacies. They're available at the doctors. They're available at other places. Get your boosters. It's the best thing you can do.
From the University of Auckland, it's Dr. David Welch, friend of the show. We can say that now officially, David. We're mates, friends of the show. Hey, thanks for joining us. Really appreciate you giving us a few minutes. And look at us hitting that time spot on. Perfect. Thanks for joining us, man.
Cheers, Pat. See ya.